Hello everyone, and welcome to my CRPS education channel. Today's video is, what is CRPS anyway? A layman's guide to the physiology and symptoms of complex regional pain syndrome. Now before we get into the meat of this video, let's get some housekeeping out of the way. I will be linking the most prevalent sources that I used while making this video in the description down below, so if you would like to check out the primary sources for yourself or show them to your healthcare professional, they are easily accessed down below. Why should you listen to anything I have to say? I am a CRPS patient who had a very difficult diagnosis experience, which meant that before I was able to get a diagnosis, I ended up having to be a patient advocate for myself. And during that time, I did a lot of research with academic papers and scientific studies to better understand what was going on with my own health and inside my own body. With the CRPS communities, threads, boards, subreddits that I have browsed or participated in, I have noticed a rather unfortunate trend where people are been told that they have CRPS, they have gotten a diagnosis, but that's it. That's all they've been told. They don't actually know what is going on or all of the vast ways CRPS can manifest. So I would like to do what I can to help remedy that situation. I want to take the research that I have done and make it understandable. I want to share knowledge and spread information and raise awareness for this disorder, so that people who are struggling with this very terrible disease can get the help that they need. Who is the target audience for this video? First and foremost, this channel is for people with CRPS, whether you are diagnosed or undiagnosed. If you have CRPS, this channel is for you above all others. This is also for people who know individuals with CRPS, whether you're friends, family members, acquaintances, loved ones, co-workers, bosses. If you know someone with CRPS and you want to help support them or understand what is going on with them, this channel is also for you. If you are a healthcare professional with a CRPS patient, hopefully, particularly this video, can help give you a better understanding of what they're going through. During my diagnosis experience, I met with a lot of ignorance about CRPS in the medical field, and I want to do what I can to rectify that. And finally, this is for anyone who's curious, anyone who wants to learn. Part of the problem with getting help for CRPS is that it's just not well known enough. It is a rare condition, and there just isn't enough knowledge being spread around about it. So, now that we've gotten those housekeeping bits out of the way, let's move on. In my experience, humans are inquisitive creatures, and two of the questions that are asked most frequently are, why did that happen, and what is going on now that it has happened? So let's start with why first, and this section is going to be a bit of a downer, so prepare yourself. Why does CRPS happen? The shorter answer is, we don't know. There has not been enough scientific study and research into this disorder to have an answer for that yet. Unfortunately, that means we don't know how to prevent it. We don't know what causes it, so we cannot prevent it from happening. There are very few effective treatment options for this disorder, and there is no cure. Once you have developed CRPS, you have it forever. It is a lifelong condition. Now, if you treat it early, usually within the first 6 months, it is possible to go into remission. But that just means that your symptoms are sleeping, they're in power-saving mode, they're not affecting your day-to-day life. That does not mean you no longer have CRPS, and it is possible to leave remission later. Well, alright, that's a bit of a downer, more than less than unhelpful. So if we don't know what causes it, we don't know how to treat it, we don't know how to cure it, we don't know how to prevent it, what do we know? We know that at its root, CRPS is inflammation of the nervous system. That means this is a systemic disorder. It affects all of your bodily functions because your nervous system runs throughout your entire body. This is the most painful disorder currently known to exist. On the McGill University Pain Scale, which is a very reputable pain scale, CRPS ranks at the top of the scale, being given a 42 out of 50. There is nothing that ranks above this. This puts it above untrained childbirth and amputation without anesthetic. This is a chronic condition, whereas if you are having a very poor childbirth experience that might last several hours, but then the baby is eventually born and the pain diminishes. That is not the case with CRPS. It is a constant state of being. All right, so now that we've gotten through that depressing outlook, let's talk about the next question. What is CRPS? The most important thing you need to understand about complex regional pain syndrome is that it is a malfunction of the nervous system. Now, before we get into what that looks like, I want to talk a little bit about how the nervous system is set up and a little bit about how it operates. If you do not have any medical experience, you're not familiar with anatomy or the terminology used when talking about your body, that's okay. I want to break this down in a way where hopefully it is understandable to everyone. So first, let's talk about how the nervous system is structured. The nervous system is set up in groups within groups within groups. And we have two main parts of your nervous system: your central nervous system and your peripheral nervous system. Your central nervous system is broken into smaller groups: your brain and your spinal cord. Your peripheral nervous system is made up of everything except your brain and your spinal cord. These are all the nerves that run from those two areas out into your body. Those nerves are broken into smaller categories themselves. In truth, this is really 3 subcategories, but I'm going to combine 2 of them because the third one really does not generally get the attention it deserves, and for purposes of our video, it's included. So just know there's really 3, but for the most part, I'm going to be talking about 2 of them. Your peripheral nervous system is broken into your somatic, autonomic, and enteric systems. Your somatic system, that's what controls your skeletal muscles, so like your biceps and your hamstrings, those kinds of things. Your somatic nervous system is in control of that, the things you actively control. Your autonomic nervous system controls the things you don't need to think about. These are your automatic reflexive bodily functions that you don't need to actively control. These include things like breathing, digestion, how open or closed your blood vessels are, how fast or slow your heart is pumping, and how constricted or dilated your pupils are. Your autonomic nervous system, with the abbreviation ANS, is divided further. So, just a quick refresher, you've got your central nervous system, your peripheral nervous system, your autonomic nervous system, and then your autonomic nervous system is split into 2 main sections: your sympathetic and parasympathetic nervous systems. Now, these 2 systems are partners, but they actually work in opposition to each other. So while your sympathetic nervous system is running at full force, your parasympathetic system is taking a back seat. While your parasympathetic system is doing what it needs to do, your sympathetic system is kind of on power-saving mode. So let's talk about your sympathetic nervous system first, abbreviation SNS. Your sympathetic nervous system is responsible for your mobilization responses. This is your fight or flight responses. It perceives a threat and prepares you to deal with that threat, whether that is facing it head on and attacking it or running away from it. But it is responsible for keeping you alive and making sure you are able to deal with things that could end your life, right? Or cause you harm. One of the other things your sympathetic nervous system does is it monitors injuries. So, let's take a thought experiment here. You're cooking dinner using a knife and you cut your hand open. Oh, ouch. Okay, that really hurt. All right, let's do what's necessary. We're going to stop the bleeding. We're going to clean out the wound. We're going to cover it so it doesn't get infected. Okay, we move on. Time passes, a day, 2, 3. Your wound has scabbed over. And you're feeling this mild burning in your hand. It's not really painful, but you're definitely aware of it. That is your sympathetic nervous system monitoring your injury, making sure you don't deal with an infection, making sure your wound doesn't reopen, making sure as your flesh knits itself back together that it's doing that properly. As your injury heals, that burning pain just kind of fades away into nothingness. That is a totally normal bodily function and very important. In CRPS, there is a severe malfunction with this system, and that burning pain never goes away. I will discuss that more in a later slide. Now let's talk about your parasympathetic nervous system. Remember, this works in opposition to your sympathetic nervous system. Your parasympathetic nervous system is responsible for your maintenance responses. These are things that happen when you are feeling safe and secure. These are your rest and digest and your feed and breed functions. Sleeping, eating food, digesting the food you've eaten, having sex, making sure that your species can continue on. Your parasympathetic nervous system is also responsible for regulating your visceral internal organs. So it's also responsible for things like your sexual arousal, how much spit you have in your mouth, your tear production, when you're going to the bathroom, and digesting your food. Now, there is one more system I want to talk about here, and we're not talking about it in its entirety, but more just certain aspects of it. And this is your enteric system. Your enteric system is the nervous structure within your digestive system, so really specifically within your digestive tract. And this is mainly controlled by your vagus nerve. Your vagus nerve is one of the 12 major nerves that run from your brain that control most of your bodily functions. Your vagus nerve is actually the longest nerve in your body, and it controls a lot. I want to discuss myelination. Myelination is the fatty substance that wraps around your nerves that makes your responses go fast. So think of this like hyperspeed in a spaceship. Anywhere that has myelination, the stimuli move very, very, very quickly. Anywhere that is unmyelinated, so it's not wrapped in that fatty substance, the stimuli go much more slowly through that area. So, specifically, your unmyelinated vagus nerve. This is responsible for your immobilization responses. This is the freeze response. This is a very, very old reptilian reaction from a different era. In modern terminology, this is what happens when you dissociate. When you start shutting down, when your body recognizes a threat that you just have to endure. You can't fight it off and you cannot get away. You just have to take it. So what happens during dissociation? You're conserving energy, you're raising your pain thresholds, and you're altering your level of consciousness, how present you are in situation. And there is one final area that I want to discuss, and this is actually part of your central nervous system, and this is the limbic system. And this is several linked areas in your brain that work together in a network. The neuroanatomy of the limbic system is a bit of a contentious issue right now, so I want to list the ones that are for sure agreed upon as being part of your limbic system. This is your amygdala, your hippocampus, your thalamus, your hypothalamus, your basal ganglia, and your cingulate gyrus. These are the areas in your brain that kind of sit right above your brainstem, and what they try to do is interact with each other to control your brainstem. And there is one other area that, again, is contested, but I am going to include in the limbic system. This is your prefrontal cortex, and this is actually an area of higher reasoning, but it is responsible for your social intelligence and how you interact with other human beings. What does your limbic system do? It is concerned with your very basic instincts and moods. It is concerned with your very basic emotions like fear, pleasure, and anger. It is concerned with your primitive drives, your need for food, your need for sex, your need to assert dominance. Again, this is part of your central nervous system. This is known as your emotional brain. And as your autonomic nervous system starts malfunctioning, it deteriorates the limbic system and reduces the gray matter there. What does that look like when your limbic system is functioning? What does that actually do? It controls your emotional responses, your behavioral responses, your memory functions, and your responses for motivation, arousal, and stimuli. So, as you can imagine, if you are having problems with your limbic system, you are having major, major issues in other areas of your life that the limbic system controls. I feel personally that one of the most debilitating aspects of CRPS, and it does not at all get the attention it deserves. So throughout the course of my channel, I will definitely be giving this a lot of attention. Okay, so now that we know a little bit about what CRPS is and how the nervous system is structured and a little bit about how it functions, what does complex regional pain syndrome actually do to the body? What does it look like? Let's talk about the symptoms of systemic malfunction. One of the hallmark symptoms of CRPS is the burning pain. So let's discuss this one first. The burning pain happens from sympathetic nervous system oversensitization. Now remember from a few slides ago, we talked about how your SNS monitors injuries and has a mild burning pain while it's activated. In CRPS, your sympathetic nervous system malfunctions, and it sends constant pain signals to the brain, which grow more and more extreme and intractable as your body switches its operating system from sympathetically maintained pain to sympathetically independent pain. And I will talk more about those two terms on the next slide. So, in plain English, what does that look like? Let's say you rolled your ankle. Your SNS is monitoring that. Okay, wonderful. Now your ankle's healed. But your sympathetic nervous system is still monitoring and saying, hey, we've got a problem here. Hey, pay attention. We've got a real issue. Hey, pay attention. Look at me. Pay attention. And so your brain, all right, well, let's check this out. Let's make sure we don't have any problems. Oh, no, everything's actually fine down here. There's no injury. We don't have any problems. But your sympathetic nervous system is like, I strongly disagree with that point of view. We have a major, major issue here. You need to pay attention. Look at this. Hey, I'm going to dial it up a little bit. You're not giving this the attention it deserves. Well, the brain looks down and is like, no, it is actually okay. There's nothing wrong here. I contest, says your sympathetic nervous system. And if you're not going to pay attention to my very valid concerns, well, you know what? I'm going to make it so you can't ignore me anymore. So I'm just going to scream. And that is what it does. It sits there and throws a tantrum like a toddler. And it doesn't need to breathe, so you don't ever get a rest. It just continues on and on and on, growing worse and more upset the longer it feels that its concerns are not being met, even though there is nothing there to fix. So what does this look like? It doesn't look like anything. It does not show up on tests, on imaging exams. This can cause a response from other people saying, it's just in your head. You are not actually experiencing what you say you're experiencing. You can hear that from family members, from coworkers, from friends. You can tell that to yourself. And unfortunately, you can be told that by healthcare providers. The pain is far greater than expected from the injury and continues far beyond when the injury should no longer be giving you grief. But it does not look like anything, and this can cause major issues when trying to get diagnosed. So, it doesn't look like anything, but the person who's experiencing it is definitely still in pain. So what are they feeling? What does it feel like to them? I'm pulling quite a bit from my own experiences here, so this might not be the only thing you could experience, but I feel like I've got a good variety here. You can feel like your nerves are made of rivers of lava, or perhaps streams of molten glass. You can feel like you're being electrocuted, or that your nerves are frostbitten. Perhaps your nerves are being forged into industrial-grade springs, and they are red hot and being twisted and compressed. On a lower pain day, you might feel like you have a grass fire in your body, or that paper is burning. Maybe you have embers smoldering inside of you, or you have your nerves feeling like they're made out of clay and being baked in an oven. CRPS is often misdiagnosed at first just because it is a very rare disorder and not well known throughout the medical field. If you are looking for a diagnosis, your best bet is going to be seeing a pain management specialist or a neurologist. But what is it often misdiagnosed as at first? Fibromyalgia, Sjogren's syndrome, migraines, chronic fatigue syndrome, myofascial pain syndrome, or Raynaud's disease. Let's flesh out sympathetically maintained pain and sympathetically independent pain a bit more. Now, the first thing to note is when you see sympathetically here, they are not talking about feeling sympathy. Okay, this is not the emotion of sympathy. This is referring to your sympathetic nervous system, the one that is responsible for your mobilization responses. In sympathetically maintained pain, your pain is being sourced from your sympathetic nervous system. Your SNS will send trauma signals to the brain, which will then react to the trauma signals even though there is no injury to heal or threat to deal with. Treatment is most effective during this sympathetically maintained pain stage before the brain adjusts to the bombardment and onslaught of constant trauma. Remission is most likely to happen during the sympathetically maintained pain stage. Now let's discuss sympathetically independent pain. Human beings did not evolve to deal well or at all with existing in constant agony and in a constant state of trauma. The brain does what it can to try to adapt to its new circumstances. This is known as maladaptation, where it is adapting to a bad situation and not always in a positive way. The way your brain connects to itself, this is known as neuroplasticity, the way it's connecting to itself, changes. During the onslaught of pain, grooves are being created. As the signals are received over and over and over, those grooves become wider and deeper until they are essentially superhighways of pain. The brain wants to use the fastest connection points, and so it will eventually run on these superhighways almost exclusively. Once this happens, it is very hard to go into remission because the brain has entirely altered itself. Regardless of what your sympathetic nervous system is sending at this point, your brain is running on the same ruts over and over and over, regardless of what else is being sent. Now that we've discussed the burning pain, let's talk about another kind of pain, allodynia. Allodynia is a painful reaction to a non-painful stimuli. This happens because your sympathetic nervous system has a lowered and reduced stimuli threshold. So what would normally not be something that is painful is treated as painful, and those trauma signals are being sent to the brain. Again, this does not look like anything on imaging tests or physically, although you might get bodily signals and likely will get bodily signals. This looks like guarding the area, being avoidant to touch, having aversion to fabric, water, vibration, especially micro vibrations. What does this feel like? Light pressure might feel like being stabbed. Clothes can feel like sandpaper. Warm shower might be treated as boiling water. Barometric pressure changes can feel like being in a hydraulic press that is trying to crush you into nothingness. This is generally properly diagnosed because it has very broad neuropathic applications. But, and you'll hear me say this a lot as we go through these slides, the source is often missed. And if you do not know what is causing it, it is very difficult to get the symptoms under control. Now let's discuss a cousin to allodynia, hyperalgesia. Hyperalgesia is having a severe pain response to a slightly painful stimuli. Let's take an example of a thumbtack or a pushpin. On a normal nervous system, that would be, oh, ouch, okay, yeah, that hurt. To someone with CRPS, this is an extremely severe and agonizing experience. This is caused the same way allodynia is. The stimuli threshold in your sympathetic nervous system is reduced. Again, this does not look like anything and does not show up on imaging tests, although you will probably receive a lot of those similar body language signs of guarding the area, being avoidant to stimuli that would cause pain. So what does this feel like to the person experiencing it? Being stabbed, being cut, being sawed upon, being punctured, being branded, being crushed. Now, there is a type of hyperalgesia that is caused by opioids. People with CRPS usually have, at some point, given opioids a try to help manage their pain. Your healthcare provider might want to try to reduce or entirely remove your opioid intake to see if that will get rid of your hyperalgesia. This is likely not going to work. Now, as far as opioids actually go, and I will talk about this more in another video, due to the anatomical changes that occur during CRPS, CRPS patients usually don't respond too well to opioids. Although, for some people, they are a very important part of pain management. So just know you might have to deal with that from your healthcare provider. Now that we've discussed the pain aspect of CRPS, let's talk about another hallmark symptom: swelling and discoloration. Now this is definitely something that is visible, and you can see it on the surface of your skin. Because you can see it through your skin, people might think it is a skin issue. This is not the case. This is actually a blood vessel issue. It is vascular malfunction. Now, your autonomic nervous system, and remember it goes your whole nervous system, into your peripheral nervous system, into your autonomic, which is split into sympathetic and parasympathetic. Your autonomic nervous system controls your blood vessels and how constricted or dilated they are. In CRPS, your blood vessels might be abnormally dilated or open, which means they're leaking blood into the surrounding area. Alternatively, they might be abnormally constricted or closed, which means they are not allowing enough blood to get into the area in the first place. Now, if you have ever looked up pictures of CRPS, probably some of the first ones that have come up are extreme and very, very severe cases of swelling or discoloration. And you might look at those and think, oh, well, mine don't look like that, so maybe CRPS is not what I'm experiencing. I am not as bad as them. Don't do that to yourself. Everyone is unique, and symptoms manifest differently, and it is much more frequent to see. They are not all cases are extreme in such a manner. So do not do yourself the disservice of not seeking care just because your manifestation of CRPS does not look like someone else's. So, what might this look like? This can look like discoloration, being red, pink, purple. Your skin might be tinged with blue. This is known as cyanosis. You might be ghost white. You might have little red dots on your skin, like lasers. Or you might be mottled. Now, mottling can be hard to determine, especially if you are in a constant state of being mottled. A good way to test this is take some light, gentle pressure, maybe with your thumb if you can tolerate pressure, and rub the area swiftly, firmly, but gently, and see if your skin pales. Or, alternatively, you can depress your skin a little bit and see if the whiteness kind of flows in as the blood gets forced out. If you can see that, you have some discoloration going on. Now, what does this feel like as regards to body temperature? Now, this might be the whole body. This might be just the area that's affected. It might be several degrees too hot or too cold. If it's too hot, usually this lines up pretty well with sweating, which might be mild to severe. This is not something someone with CRPS has any control over whatsoever. And this can often lead to feeling gross. If you are the person with CRPS, I'm very sorry. If you are the person who knows someone with CRPS and you notice this, maybe don't comment on it. There is nothing they can do about it. And what does swelling look like? This is called edema in the medical field. This can affect the area where you are experiencing pain, but it might also affect your hands and feet. And this might be so severe that your body part is twice the size that it should be, or more often, it might be moderate to hardly noticeable, where you just have maybe a little bit of extra fluff on your body. If you are dealing with weight loss, this can cause some issues where the amount of swelling is proportionate to the amount of weight that you have lost. So your area might look approximately equivalent in size to what it was before you started losing weight and muscle mass, which can make it hard to differentiate. So do pay attention to see, do I actually have swelling here that is just being disguised due to some other symptoms that I'm experiencing? Now, what does this feel like internally? As far as body temperature goes, you might feel like you are melting, absolutely melting. This usually lines up quite well with sweating. Or, alternatively, you might feel like you are radiating coldness. Not just that you feel cold, but you are the source of the cold. Your extremities, especially your fingers and toes, might feel like clay and be non-responsive. You might also experience numbness, whether that is feeling like your leg is asleep or whatever body part it is that you're experiencing this pain in, asleep, pins and needles sensation, or static. You might be told this is due to hypo or hyperthyroidism or some other sort of endocrine dysfunction. So now that we've talked about blood inside the body and blood vessels, let's talk about where that blood comes from. We're going to discuss your heart, lungs, and blood pressure. These are your cardiac and pulmonary systems. Cardiac's heart, pulmonary is lungs. Your oversensitized SNS is in charge of your mobilization responses, and it might find threats where there are none and prepare a mobilization response even though none is necessary. Another cause is your cortisol levels and dystonia. Now, dystonia is an uncontrollable muscle contraction. These two things can prevent full lung and diaphragm expansion. So what does this look like? Rapid or shallow breathing, arteries throbbing in your neck, redness in the face, or flushing. Intractable hypertension. Now, hypertension is having a blood pressure that is too high. Alternatively, varying blood pressure, usually related to stress. This might mean your blood pressure is normal, and then it's too high, and then it's normal, and then it's too low, and then it's too high, and then it's normal, and then it's too low, and it stays too low, and then it's too high, and then it goes back to normal, where it just alters and is not consistent. You might also notice blood in the urine. This is due to hypertension, the high blood pressure. Kidneys are responsible for filtering toxins out of your blood and creating urine. And when you have blood pressure that's too high, that can damage your kidneys. What does this feel like internally? You might notice a racing pulse or a slow pulse. You might have chest pain. You might feel like your heart is working too hard. You might feel like your lungs aren't fully expanding, so you might be experiencing shortness of breath, lightheadedness, or you might even be fainting. Blood pressure fluctuations, sometimes you can feel that and you can just feel like, oh, okay, there's not enough blood getting to whatever body part it is. Usually you might notice that in your head, the lightheadedness. Or, oh, okay, I can really feel my heart in my neck right now. That usually has to do with your blood pressure. So, all of these diagnoses here are correct terminology, but again, they would be sourced from your CRPS. Tachycardia, that means having a heart that is working too fast. Brachycardia, slow heart. Angina, this is coronary artery spasms. The coronary artery is the massive artery that leads right out of your heart. Vertigo, pre-syncope, this means feeling like you want to pass out but not actually doing it. Syncope, this is actually passing out. This has to do from your blood vessels being too constricted and you're not getting enough oxygen to your brain. Restrictive lung disease. So let's move away from pain and the systems responsible for circulating blood around your body, and let's move into your bodily structure. Let's talk about your muscles first. Dystrophy and atrophy. Now, these two terms are quite similar and often used interchangeably, even though they deal with slightly different things. So I want to discuss them a little bit before we get into the rest of this content on this slide. Dystrophy has to do with actual muscle wasting. Your muscle weakness, your muscle decay, your muscle degeneration. That is dystrophy. Atrophy has to do with nerves, and then subsequently the muscles that those nerves control. So dystrophy has to deal with the actual muscles, and atrophy has to do with the nerves that control those muscles. So, what is the cause for muscle wasting? One of the few things you probably remember from school is that the mitochondria is the powerhouse of the cell. So, your mitochondria produces ATP, And that's just really basically a fancy word for energy. Now this happens only in the affected area. This is not a whole body thing. When you are not producing enough energy, you cannot do things. Energy is required for lifting things up, for walking, for running, for moving things around. Anything that requires a muscle contraction also requires ATP. Your mitochondria are not producing enough. So what does this look like? This looks like reduced stamina, reduced strength, reduced stability, and reduced range of motion. This looks like dystonia, those uncontrolled muscle contractions. This also can look like deteriorating or illegible handwriting. What does this feel like? It feels like cramping, clenching, twitching, fluttering, tremoring, and general weakness. In your hands, this feels like clumsiness, having butterfingers, constantly dropping things. You might be diagnosed as having myoclonic jerks, dystonia, tremors, or other related movement disorders. So when we discuss muscles, we need to discuss what suspends our muscles and allows them to contract. So let's talk about bones next. In CRPS, your bones start to thin. This happens because your bone cells are being reabsorbed by your body faster than your body is creating new cells to replace them. This looks like flexible or easily damaged bones. After a certain point, not straight from the beginning, but after you've lost a certain amount of density and mineralization, this is visible on imaging tests. What does this feel like? This can feel like a slow, corrosive acid in your bones. This can feel like your bones are made out of ice that are melting from the inside. What you might be diagnosed as, I actually want to talk about the last one first. Notice in all three of these, it starts with osteo. Osteo means having to deal with your bones. Let's start with the last one, osteonecrosis. Necrotic, dying. Osteonecrosis is bone death. Osteopenia is bone loss that is definitely worthy of concern and needing to be taken care of, but it's not quite as severe as osteoporosis yet. And then you have osteoporosis, which is very thin, fragile bones that requires you to be very careful so you don't end up with a break or a fracture. The important thing to note about this is that CRPS causes localized bone loss. So in the area that you are experiencing your pain, that limb is where you will be experiencing bone loss. This is not generalized osteoporosis throughout the entirety of your body. So if you have to go through a bone scan and your pain is in your foot, but they are scanning your spine and hips, the results will likely come back as normal. That does not mean you don't have bone loss. That means they just didn't check the right area. Let's move on. So we've talked about muscles. We've talked about bones. Now let's discuss joints. When your muscles stop working, they stop holding your bones in place. And when the muscles are not holding your bones in place, the bones move. And where bones meet and don't line up can cause pain and joint malfunction and instability. So what does this look like? This looks like limbs being held at awkward angles or being twisted. And this has to do with trying to accommodate the way your bones are now sitting. This can look like swollen or deformed joints, which can cause partial or full dislocation. Especially if you are experiencing swelling at the joint, it can be difficult to see if your bones are unaligned. This is something you will definitely be able to feel, though. So what does it feel like? It feels like trying to break an airlock, having some solid piece of metal, maybe rebar, through your joint, having a joint that is made out of a very heavy metal, like lead, stiffness, inability to move. It can feel like an awl or a metal knitting needle, trying to penetrate your joint and using its own leverage to force your bone out of socket, particularly in ball and socket joints, which would be like your shoulders or your hips. You might feel like something that should be nice and smooth and frictionless has changed to a cheese grater and is causing lots of pain and friction during movement. What might this be diagnosed as? Osteoarthritis, rheumatoid arthritis, or some sort of prior joint injury that is now, later, causing pain. Now let's move into our internal visceral systems. Let's start with the urinary tract. First, what organs are in our urinary tract? Well, first you have your kidneys, and you have two of them, one on either side of your spine in the middle of your back. These are responsible for filtering blood and creating urine to remove toxins from your system. Your ureters, these are the tubes that run from your kidneys to your bladder. Your bladder, responsible for holding urine until you excrete it, and your urethra, which is the tube that runs from your bladder to the outside of your body. What causes problems? First, your increased blood pressure can affect your kidneys. We already discussed this a bit. Your autonomic nervous system, which is your sympathetic and parasympathetic systems combined, is responsible for all the things you don't have to think about, including your internal organs. So as your autonomic nervous system is malfunctioning, it can be either over or under firing. And these nerve responses can cause your internal organs to malfunction. So what does this look like? Increased urine frequency and output. Thick, cloudy urine. Maybe you've got some little filaments in there that look like strands of hair. Maybe you have dust-like or sand-like particles in your urine. You're at an increased risk for urinary tract infections and kidney and bladder infections. What does this feel like? A shrinking bladder. Maybe you feel like you now have a child's bladder where you have to go all the time. Maybe you have to go 50% more than you did. Maybe you go 80% more than you did before. Maybe you have to go every hour or multiple times every hour. The sensation is unbearable. You cannot not go to the bathroom. Even if you're only releasing half an ounce of fluid into the toilet, you still have the overwhelming sensation that you might wet yourself if you do not go to the bathroom right now. You might experience mild to severe burning or heat while you're using the restroom, and you might experience kidney pain. Similar diagnosis: interstitial cystitis or chronic bladder pain, pelvic inflammatory disease, or sterile abscess. So if we've discussed urinating, let's talk about defecation and your gastrointestinal tract. This is your digestive system. Exact same problem that is going on with your urinary tract here. Your autonomic nervous system is either over or under firing, which can cause rapid digestion or very delayed digestion and other defecation issues. This is happening because your internal organs are inflamed. Remember, we said the root of CRPS is the inflammation of your nervous system. And your nervous system innervates all of your internal organs. So they end up becoming inflamed as well. So what does this look like? You might have an over or underactive appetite. You might have food aversion. Now, food aversion here actually has to do with your limbic system, and I will discuss that on a later slide. Inflammatory foods like white flour, white sugar, and high fructose corn syrup can make all of your digestive issues worse because they are creating more inflammation in an already inflamed system. And I will discuss this in a later video and what you can do to help reduce these symptoms, because this is definitely something that you might not be able to get fully under control, but you can definitely make better for yourself. This looks like constipation or chronic diarrhea, vomiting, nausea, weight loss. Food is no longer being fully properly absorbed, so you might also end up with a nutrient deficiency. What does this feel like? Severe GI pain, cramps, abdominal stabbing. You might feel like you have brambles in your intestines that are getting yanked on, or bubbling. Your stomach might feel like it is empty and starving. You might feel like your stomach is shrinking. And when you do eat, you might experience pain in your stomach because it is getting used to being underfilled. Similar diagnoses here: irritable bowel syndrome, IBS, GERD, or dysphagia, which is when you have difficulty swallowing. Now let's talk about getting sick. Let's discuss the immune system. Your sympathetic nervous system controls your immune system. So any stress that triggers your SNS is also triggering your immune response. During the first 2 years of CRPS, you have a very high immune response. This is something that can be tested on a white blood cell count, and you will notice a high T cell lymphocyte count. T cell lymphocytes are a kind of white blood cell that are responsible for eating and dealing with pathogens to prevent you from getting sick. After the 2-year mark, you have a permanently disturbed healing ability and an underactive immune system. You have a permanently raised level of killer T cells and a suppressed level of helper T cells. Again, those are kinds of white blood cells responsible for dealing with pathogens. And if you cannot deal with pathogens in your system, you will get sick. What does this feel like? Constant low-grade fever, spontaneous bruising, abnormal hair or nail growth. This might be that you are rapidly growing hair. It might mean that you're losing hair. It might mean that your nails are thin or very thick, ridged, grooved, clubbing. You might have ulcers, itchy skin, swelling, or frequent illness. Your immune system is a dynamic system, so it's very much like the tide. It goes in and out, up and down, ebbs and flows. So do not expect your immune system to remain constant. It will be over and underactive. These diagnoses down here at the bottom are basically things we've already talked about, but just given their proper medical terminology: neurodermatitis, pruritus, trophic ulcers, edema, thoracic ulcer syndrome, carpal tunnel syndrome, spontaneous bruising, entrapment, and dystrophic changes. So let's start moving away from the neck down of our body, and let's start focusing on our head and the important parts of our body that are contained there. First, let's talk about our hormones and our endocrine system. The endocrine system is the network throughout your body that is responsible for making sure your hormone levels are appropriate. When you have a hormone imbalance, this usually happens in your hypothalamic, pituitary, and adrenal sections. Now, your hypothalamic and pituitary, that's in your brain. And the adrenal area, those are actually two glands that sit right on top of your kidneys. And then, again, you have your hypothalamic, pituitary, gonadal systems. Hypothalamic, pituitary, again, that's right there in your brain, in that limbic system. And then your gonadal response would be like your estrogen or your testosterone, your sex hormones. What does this look like? This might look like having a low thyroid hormone level. Your thyroid is right in your neck by your voice box. And low serum cortisol levels. This might look like having sexual dysfunction, brittle nails, dry skin, or hair loss. Now, this hair loss might not be on your head. It might be, say, you're experiencing wrist pain. Okay, your CRPS is in your hand. You might notice that you're losing hair on your forearm, hand, and wrist rather than on your head. This might feel like tired, being fatigued, chronically exhausted, being sluggish, feeling cold. This might be diagnosed as hypothyroidism or hyperthyroidism. Let's discuss two of our other senses, our vision and our hearing. What happens what is the physiological cause of problems with our eyes and ears? This is caused by constricted arteries that are too closed, too tight, in your cervical spine. The cervical spine, that is the back of your neck. When the arteries in your neck are too tight, you are not getting enough blood to your brain. And this can cause problems in your vision and hearing centers. What does this look like? Squinting, rubbing your eyes, actions resulting from poor vision, or reduced hearing ability. Internally, this can feel like blurring vision, difficulty reading, problems focusing, dizziness, and dry eyes. You might experience tinnitus, which is a buzzing or ringing in your ears. This can be quite loud, or this might just be background static that just makes you have to listen a little bit harder to make sure you're actually hearing what you think you're hearing. Similar diagnosis: keratitis sicca, having detached retinas, having pain from sound, or tinnitus. If you are having vision problems or hearing problems, you are probably also experiencing migraines. You might also experience migraines without the vision or hearing problems. Now, not just in CRPS, but as a whole, the causes of migraines are not yet fully understood, although there is correlation between genetic and environmental factors. This might have to do with your trigeminal nerve, which is a major pain pathway. It might have to do with serotonin, which helps regulate pain. We're not quite sure. But what does it look like? Sensitivity to light, smell, noise, being nauseated, or having vomiting. Difficulty speaking or completing tasks. Maybe they just want to go lay down in a dark room with no noise. What does this feel like? Visual disturbances, seeing shapes, bright spots, or light flashes. You will absolutely be having a throbbing, pulsing pain. Usually this is on one side of the face or head. There are other kinds of headaches like tension, stress, cluster, sinus, neck, TMJ headaches, but usually the ones that are a major factor with CRPS are the migraines. And this is our last slide here before we get into truly the state of your head. Let's talk about your sleep cycle and insomnia. This happens when your limbic system deteriorates. CRPS prevents REM, which is your rapid eye movement sleep. During REM, that is when your body regenerates and rejuvenates and heals itself. When you cannot fall into REM, the worse your pain becomes. And the worse your pain becomes, the harder it is to fall into REM, which creates a very vicious feedback loop. What does this look like? Difficulty falling asleep, difficulty staying asleep, waking up too early, waking up multiple times during your sleep, daytime tiredness, feeling exhausted even though you have slept, dark circles under the eyes. In action, this can look like increased errors, increased irritation, lack of attention, and a lack of focus. What does this feel like? Chronic exhaustion. No matter how much you have slept, you do not feel rested. If you are not getting the proper amount of rest, you are probably also dealing with anxiety and depression. This is caused by CRPS. You do not have CRPS because you have anxiety and depression. Now, you might have had those before as well, but your CRPS causes these symptoms as your limbic system deteriorates. This is not something you have control over. I'm sorry. But if you have CRPS almost across the board, 90+% of people with CRPS also deal with anxiety and depression. You might also be experiencing headaches, those migraines we were talking about, sluggishness, difficulty with your memory, concentration, and temper. Those have to do with insomnia. They also have to do with limbic system deterioration. Insomnia is usually easy to diagnose, although the cause of it, again, can be mislabeled. They might say you are having insomnia due to alcohol or caffeine intake, or when you're eating your food, your work or travel schedule, which medications you're taking, other mental health disorders like PTSD, and, again, CRPS is living in a constant state of trauma. So if you were experiencing PTSD before from something that is not CRPS related, this is probably going to make your PTSD worse. Sleep-related disorders like sleep apnea or other medical conditions, and this is where CRPS will fall. This is the last symptom I'm going to talk about in this video, the state of your limbic system. Before I get into this, I will clarify one more time. I feel extremely strongly about this symptom. I do not feel it at all gets the attention that it deserves, and I will be covering a lot of content regarding it in the future on this channel. CRPS attacks your limbic system. This is not your fault. There is nothing you can do to prevent it, and I am very, very sorry. My position is that you are a brain. You have a body. You are a brain. Your body is there to make sure your brain gets what it needs so that it can function and interact with the world. But you are the connections in your brain. To me, this limbic system deterioration is truly an attack on the self. And it is very, very unfortunate. I am so sorry that you are experiencing this. But sometimes we just need to deal with things as they are and not as we want them to be. So, let's discuss your mental state. The constant pain and trauma signals end up changing and degrading neuroanatomy. This causes a reduction of gray matter in essential areas of the brain. It is absolutely impossible for the limbic system to remain intact in the face of CRPS. This is not your fault. What does this look like in action? This looks like severe depression, anxiety, insomnia, irritability, agitation, aggression, panic attacks. You might have poor memory, poor word recall, where you just, can't find the words you really want to say. Executive decision making, making the choice, the definitive decision, right there, right then. Concentration, focus, judgment, impulse, control, motivation, your appetite, and long-term planning. Now, I said I'd discuss the appetite a little further from a previous slide. Your limbic system is responsible for your hunger impulses. So when your limbic system is degrading, you might feel that food is physically repulsive. You cannot, not only can you not contemplate eating, if you actually bring food to your mouth, you might start gagging because your brain is telling you food is absolutely not anything that you want right now. What can this feel like for the person experiencing it? You might be disconnected from your emotional memory, which means either you know you were upset, but you don't know why, or you can remember a situation, but you don't remember what you felt about it. You exist in the now. The past, you can't remember. The future is too far away. You can't really grasp it. You can't remember what happened recently. Maybe that's 2 hours ago. Maybe that's 18 hours ago. Maybe that's 3 days ago. You might experience swift and extreme emotional changes. You might go from fear to anger to wanting to cry in less than 30 seconds. And they can all be very, very extreme sensations. Not only is your impulse control degrading, the impulses themselves are getting stronger. Fear, rage, aggression, placidity. Now, placidity is when you don't have a reaction when you should. Let's say something's on fire. Oh, okay. That might cause anger for some people. That might cause fear. Whatever it is, it's definitely going to spark some sort of reaction. Maybe you just don't care. Oh, it's on fire. You should probably do something about that. At some point. Maybe. If you can work up the motivation. That is not you being lazy. That is your neuroanatomy degrading. Again, it is not your fault. This might mean you are lacking internal motivation. Strangely enough, this does not seem to affect external motivation. So if you have someone in your house who can help you set goals, it might be very beneficial for you. If you tell yourself, okay, today I'm going to do the laundry, it's going to happen. But you can't work up the internal motivation to actually do it. But if your child or your partner, your roommate, whatever, says, hey, can you please do the laundry today? I'd like it to be done before we go to bed. You're much more likely to actually be able to act on that. And social cognition here. This has to do with the degradation of your prefrontal cortex, your social intelligence, which might mean things you end up doing things that are not socially appropriate at all. Again, feeling like food is repulsive. You might have altered dreams. You might be hypo or hypersexual. And you might be experiencing hyperorality. Now that means constantly wanting to have things in your mouth. What other things might this look like? Dementia, ADHD, Kluver-Bucy syndrome, bipolar disorder, or PTSD. We have covered a lot of content in this video. We have discussed what we know about why CRPS happens, what CRPS is, and how the nervous system is structured, and a bit about how it functions and malfunctions. And we have talked about what the systemic symptoms of nervous system malfunction looks like. Here's a quick glance at what they all are. The burning pain, allodynia and hyperalgesia, skin and vascular changes, problems with heart, lungs, and blood pressure, muscle atrophy and dystrophy, thinning bones, joint pain, issues with your urinary and gastrointestinal tracts, problems with your immune system, problems with your hormones and your endocrine system, issues with your eyes and ears, migraines, insomnia, and limbic system deterioration. I will be making more videos, even if nobody decides to watch them. This is very therapeutic for me, so I will absolutely be continuing. A few topics I know I want to cover in the future are the stages of CRPS, the Budapest criteria, looking at each systemic complication in depth over the course of several videos, limbic system deterioration for people with CRPS, how to help someone who's experiencing limbic system deterioration, meditation, medication and surgical options, physical therapy and MNRI, and dietary changes. If there is something else you would like me to cover that I do not have listed here, please let me know. I am open to suggestions and I want to help. So if you are having problems finding the resources necessary, or you just can't do the research on your own, please let me do that for you. If you would like to contribute to my Patreon to help me afford my medications, the link is here to the left. I don't have any new videos yet, but once I do, I will be putting links over here to the right. Thank you so much for watching and for giving me your attention. I hope this was at least a little bit enlightening. Hope to see you next time.